I started at the Globe in 1981, the day Ronald Reagan was shot, and Betsy started in 1982, so we were basically young general assignment reporters who were kind of in the same class, and we kind of found each other and became friends pretty quickly. She was a daughter, she was a sister, she was a mother, she was a wife, she was an excellent friend, all together in one pretty remarkable person.
Betsy was a very bright, a very compassionate, enthusiastic person, good reporter. She had the respect of the Boston medical community because her reporting was so thorough. She became a medical columnist, founding the column called Health Sense. She was very early in doing that kind of personal health column. Betsy really kind of established her own voice, a very trusted voice, a conversational voice. It was different from straight reporting, in which the writer is supposed to be sort of not there. Betsy was, projected her own personality. Betsy was about as well-informed a patient as you could be, I think, about a lot of things, but she, as I recall, approached her own treatment the way she would if she were reporting a column for readers in general. I mean, she researched it thoroughly. She and Bob Distel, her husband, interviewed oncologists around the country.
Betsy Lehman had advanced breast cancer. She was receiving high-dose chemotherapy. Betsy thought she was having an atypical response. She was actually frustrated with the institution over a lack of response to her concerns. On the day before discharge, she died.
It was a Saturday, as I recall, in early December, and I was at home and got a call from Adam Pertman, who's a Globe colleague and happens to live across the street from me, and a close friend of Betsy's. And he said that Betsy had suddenly died, and it was just, how can this be? Because she was at the end of her chemotherapy, she was reportedly doing well, she was planning to go home and celebrate Hanukkah with her children, and it was just totally out of the blue. We knew that the treatment was rigorous, but we thought she'd already gone through the worst of it and it pulled through.
After Betsy's death, there was no indication that an error had occurred. It was a few months after, in February of 1995, a data manager entering information on Betsy into a protocol system noticed she received 4 times the chemotherapy she should have received.
Weeks later, I got called into that room over there by Nils Berzelius, who was the health and science editor at the time, and we sat down. He said, "I have to tell you something, it's going to be a shock." And he said, Betsy suffered from a massive overdose, and that's what killed her. And I think it was evident to both of us immediately that we would have to report this.
In 1994, I was an assistant commissioner for public health, did routine inspections of healthcare facilities, and also did investigations of healthcare facilities. I found out about the incident by reading the Boston Globe the morning that the story came out. Dana-Farber was by far, one of the best hospitals in the country from every perspective. It became quite clear, and really it was kind of news to us as well, that healthcare was not as safe as everyone thought it was, even in a medical mecca like Massachusetts. In the aftermath of what happened to Dana-Farber, we had a number of reports come forward of serious incidents that were occurring, adverse outcomes that were occurring to patients in some of our best hospitals, some of the very best hospitals in Massachusetts. And if you looked, you would find, and you'd find deaths.
Betsy's death was really a watershed event. Before that, some of us had been talking about the problem, but not many people were listening or interested. Neither the public nor the medical profession thought that medical error was a problem. The prevailing culture was to not talk about it. It was considered, a human failing, and therefore we don't want to tell other people that we're less than perfect, and we don't want to blame others. And so it was really a conspiracy of silence, not as trying to prevent people from knowing anything, but just because it just wasn't seemed the right thing to do. People get much more excited about one case of Ebola in St. Louis than they do about a jumbo jet worth of people being killed every day from medical error. The consequences of our mistakes are borne by the patients. We've had a culture that is opposed to change and opposed to outside interference. That is, we have never felt that anybody else was qualified to tell us how to do things. Thank you very much. And on the other hand, we think we do a pretty good job, and we like the way we're doing it. We're very much invested in the status quo, and we have a very hierarchical system which perpetuates that. And so what we're really talking about is how do you change that?
Not everybody was in agreement that we should have a center looking at over somebody's shoulder and potentially reporting and studying mistakes or how to prevent them, that was necessarily a role for government to take on. But we do have a role in quality control and in safety, and I think it's important that government play a role, not necessarily mandate everything, but certainly point the way to best practices. Educating the profession and the public was probably one aspect of it. Also, being able to assemble experts to look at a situation or an error that occurred, or even a type of conditions that could be subject to error. What can we do better? Connecting the center to someone who was known, particularly known in the media, known in that venue, would be an appropriate way to remember her, but also to gather some public awareness and public support.
My vision is first that we set a bold aim. The bold aim is that we commit to reducing preventable harm to zero in the Commonwealth. I would like to see us become much more focused on foundational systems to improve safety across all hospitals and across all care settings in the Commonwealth of Massachusetts. To have Massachusetts be a community that's working together, ground in solid data and ground in a bold vision.
Set no minor goals. If you want to accomplish something, think big. Massachusetts could reduce medical errors by 50% in 5 years if we really put our attention to it.
And I think the Lehman Center, now that it's got a more stable organization and funding, will be in a position to realize the vision that a number of folks and I had 12 years ago.
I think it's important that a center like the Betsy Lehman Center be named after a person, because it's a reminder that these preventable medical errors happen to real people and that they interrupt real lives. But I think it's a mistake to only associate her name with the tragic way in which she died. And to me and the people who knew and loved Betsy, the name Betsy Lehman is about a whole life, and a whole life that was lost, a whole life that was interrupted. If this can happen to a patient like Betsy, we're all vulnerable.